MC-101A portable anesthesia machine and MC-1010 anesthesia ventilator. Operation introduction. Appearance and buttons. Anesthesia ventilator. Breathing circuit system. 7-inch TFT display screen. Panel. Mute button, silence the alarm. Menu button, it have 4 function options. You can select ventilation mode, waveform, patient and calibration. Cancel button, return to the previous step. Increase and decrease button, press the button to increase or decrease the setting value. Alarm setting button, set the alarm upper and lower values. Setting button, setting parameters under the each ventilation modes. Confirm button, confirm the settings after parameter adjustment. VT adjust knob, adjust the tidal volume. Bellows gas output port. Ventilator safety exhaust port. Bellow gas input port. Threaded pipe. Ventilator gas output port. Power supply switch. Oxygen concentration sampling input port. Tidal volume sampling input port. Oxygen input port. Power supply socket / fuse box. Equipotential terminal. Driving gas outlet. Portable anesthesia machine. Nitrous oxide pressure gauge. Oxygen pressure gauge. Oxygen flush button. 4 tubes of mechanical flow meter, nitrous oxide, oxygen. High precision vaporizer, maximum 1. Up-down bar. Knob for locking the up-down bar. Fresh gas common inlet. Breathing bag terminal. Bag vent selection knob. Inspiratory hose. Inspiratory valve. Pressure gauge and breathing circuit. APL valve. Carbon dioxide absorber canister. Expiratory hose. Expiratory valve. Gas output port, connect anesthesia ventilator. Gas source connection port, oxygen, backup oxygen, nitrous oxide. Exhaust gas port. Gas input port, connect anesthesia ventilator. Pipeline connection. First, we need to connect the anesthesia ventilator to the portable anesthesia machine, then connect pipeline power supply and breathing circuit. The front and back connections are shown in the figure. Display interface. Anesthesia ventilator display interface. Ventilation mode display area, the current ventilation mode is displayed. Patient type display area, the current patient type, adult or pediatric, is displayed. Alarm information display area, the mute 120 seconds countdown and current alarm information are displayed. Power status display area, the current power status is displayed. System time display area, the current time is displayed. Monitoring display area, the currently monitored parameter data is displayed. Waveform and loop display area, the waveforms, loops or monitoring data are displayed. Parameter setting area, the current ventilation setting parameters are displayed. Operation. Set the bag vent selection knob to the vent position. Power on the anesthesia ventilator. Enter standby mode directly. Adjust flow meter, press confirm button. The machine start working in VCB mode. Press oxygen flush button, inflate the bellow. Press the setting button to begin configuring parameters. When the parameter display turns red, use the increase or decrease button to set the desired value and press to confirm. Similarly, set the other parameters. Adjust the tidal volume by turning the knob left to increase, right to decrease. The tidal volume data will be displayed in the screen in the monitoring data area. Alarm setting button, set the alarm parameters. When the parameter display turns red, use the increase or decrease button to set the desired value and press to confirm. Then press parameter setting button to change the different parameters which need to set. Press the menu button and select the desired ventilation mode VCB, SIMV, 8C. Press the confirm button after selecting it. Press the menu button, select waveform. We can select flow T, vol T and D PAVOL. Select PAVOL, confirm. 3 loops will be displayed on the screen. Press return button, enter bag mode. Press menu button. Select adult pay to switch between adult and pediatric settings, then press confirm. Select calibration to perform oxygen concentration, if optional, and time calibration. When the parameter display turns red, use the increase or decrease button to set the desired value and press to confirm. If an audio or visual alarm is triggered, press the mute button to silence it. The alarm will have a 120 seconds countdown. The doctor may adjust the breathing mode and parameters at any time based on the patient's needs. Manual. If you need to enter manual ventilation mode, first put the machine into standby mode, set the bag vent selection knob to the bag position. Adjust the flow meter appropriately. Fill the bag with oxygen, flush quickly. Then press the bag regularly for manual ventilation, according to the actual situation. After manual ventilation is completed, close the flow meter and open the APL valve to release the gas in the bag. After use, turn off the vaporizer. Turn off the flow meter. Set the bag vent selection knob to the bag position. Confirm that the machine enters standby mode. Turn off the power. Thank you.